My name is Dr. Mary Doherty. I'm an Irish consultant anaesthetist. I was diagnosed with autism in 2013, and my clinical role involves anaesthesia. My research interest involves looking at barriers to healthcare for the adult autistic community, both in physical healthcare, general practice, and in mental health services. The barriers fall into two separate categories. One is in terms of difficulties accessing services, and that's things like difficulty using the telephone to make appointments, and that's the most common way of making appointments. But then there's also subsequent difficulties once people have accessed the service. There's difficulties interacting with practitioners, with healthcare providers around communication. There's difficulties in the physical environment, sensory sensitivities. And then there's practical issues, such as people needing support to access healthcare, practical issues around organising and planning for appointments and planning for follow-up care. So there's multiple barriers faced by autistic people, which have significant consequences in terms of adverse healthcare outcomes.
How do you think services could make themselves more accessible and even challenge wider barriers in society?
There's a lot of really simple things that can be done. And the most important need is for understanding and training and awareness of what it means to be autistic. Awareness of the barriers that we face, simple environmental accommodations, even such as recognizing that your typical healthcare waiting room is an absolute sensory nightmare, and allowing a patient to wait outside. Other things such as training, we need to embed autism understanding and training for all health and social care providers from the very earliest days of training right up to experienced practitioners. But mostly, I think, just changing the culture such that autistic colleagues can disclose and can help non-autistic colleagues to understand our autistic patients and our autistic service users. But currently, stigma means that most autistic healthcare providers don't disclose, which is a real shame.
Is there anything else that you can think of that you would like to say to health and care providers particularly?
It's important to recognise the impact that our interactions with our autistic patients have in terms of adverse healthcare outcomes. We know that mortality and morbidity rates for autistic people are appalling. Prior negative experiences in healthcare are an independent barrier of future care for autistic people. So it's really important that when we interact with autistic people, we're considering future care, not just the immediate interaction.
Yeah, okay. I could ask you what you think services outside of healthcare, specific services, could do that might impact on healthcare outcomes for autistic people.
Yeah, that's a really important issue because, as I said, a lot of the difficulties that autistic people have accessing health are to do with what we might term executive functioning difficulties. So planning appointments, organising appointments, remembering to take medications, being able to pick up medications. Commonly, people are referred to a specialist, but simply don't make the appointment, never get around to making the appointment. If an appointment needs to be changed, just simply don't get around to changing the appointment and then never follow through. And there's a very specific need for social support to access healthcare. Because also, we tend to assume in health services, we tend to assume that people will have friends and family to be able to fill that gap. And quite commonly for the autistic population, that's not the case. In my research, for example, approximately 1 in 5 people had nobody available to bring them belongings after an emergency hospital admission, or to collect them after a day case procedure, or to look after them following surgery at home. So it's important to recognise that there is a very specific need for social support, for example, for social care workers, for support workers, and to understand their role in supporting people to access healthcare would be really important. One other thing that's useful would be It's where practices have like a specific liaison person. And that can be really beneficial for the autistic community. And again, that is social support, but it does facilitate people accessing healthcare.